Hi, my name is Debbie Tancredi. I'm the Director of Pupil Health and a school nurse for Pennsylvania Virtual Charter School. Hopefully you've been able to see the Pupil Health site on Blackboard. If not, log in as a parent, click on the parent organization, and then click on the Pupil Health folder. There you'll see all the information for the department. The health screening sites for this year, important forms, health exam forms for your physician or your dentist, and all other procedures and protocols for the department. We invite you to come to a site because all health screening is mandated every year for every student, every grade throughout the state of Pennsylvania. Pennsylvania Virtual Charter School, unlike a brick and mortar school, cannot do these in the office of the school nurse, so we invite you to a mass screening site. Most children find that the sites are fun and they enjoy them. When a student arrives at a health screen site, we ask that the parents sign in so that we have an accurate time of when you arrived and that we can move you through. If you had already sent in a health screen from your physician, sometimes we will call and let you know that near vision wasn't included. You can then come to a site just for near vision or perhaps even just for hearing. When you sign in, please mark that on the sign-in sheet so we know you're here for just that screening and we'll move you through very quickly. The first step is that the student would take off their shoes and then we can get an accurate height. This is done by a stadiometer. We then move on to the scale, which is a calibrated scale. And the information is then turned into their BMI, body mass index. When the student leaves the site, the parent will have with them the results of their BMI and some information about what it means. BMI sometimes is used as a screening tool, but it sometimes will alert us to a student who may be underweight or overweight. The next step is vision screening. We have Titmus machines, and we sometimes also use Snelling charts to do this. Far and near vision is mandated for every student, every grade, every year. Also, we have accessory vision that's mandated for grades 1, but sometimes is done for grades 2 and 3 if it had not been done before. And this would include color vision, 3D vision, and convex lens tests, which would tell us if a student has excessive farsightedness. The next step that we go to is our hearing station. By using an audiometer, we're able to screen a student's hearing capacity. The nurse would tell the student the instructions on how to raise their hand and identify which ear they hear the sound. After that, we move on for some students to scoliosis. This is mandated for grades 6 and 7, but we recommend it for any student above grade 6. The screener here looks at the student's back. If a female is being screened, then they would be asked from the screening information to wear a sports bra or a bathing suit top. And what we look for is symmetry at their back. We look at the shoulders, the scapulas, we look at the waistline, we look at the diamond shape between the arms and the waist and make sure that it is even on each side. The student then bends forward in a diving position and we look at the hump of the back to make sure that it is even and that there is no asymmetry on either side. Throughout all the screening, we keep a log of what the results are. The parent is then brought to the checkout table and given the results. If the student does not pass hearing or vision or scoliosis, we have another nurse re-screen them at the site. If they still do not pass, then we give the parent a referral form and an exam form for an eye specialist or a hearing specialist. Scoliosis referrals are usually back to the family physician. Those forms are requested to be returned to us within 6 weeks. All of our vision, hearing, scoliosis screening is done by at least RNs. Most of the nurses are school nurses, and some are even graduate level or nurse practitioners. We hope that you're able to spend some time with us this year and come to a screening site so that you know your student's file is complete. Thank you.